Good morning, my name is Elena Tejada and I'm gonna be reading the Professional English in US Medicina, the exercises, and I'm going to start with chapter 24. So 24.1, match the two parts of the sentences, look at A, B, and C opposite to help you. 1. In 1988 saw the UK launch of Live Attended. That's a measles, mumps, and rubella MMR vaccine. 2. Chickenpox varicella is a common infectious disease of childhood. Rabies has an incubation. A period ranging from 4 days to many months. The patient remained febrile, with peaks of temperature of 39.5 Celsius. 5. He was admitted with a 4-day history of influenza-type symptoms of fever with rigors, myalgia, and general malaise. 6. Quite a proportion of patients who recover from hepatitis B become carriers of the virus. 7. The Central Part of Africa is in the midst of an epidemic of AIDS. 8. Measles rubella is most infectious during the chiral stage. 9. Lyme disease is caused by transmission of B. Burdenferi from animal to man by exotic ticks. 10. PUO stands for pyrexia of unknown origin. 24.2. Complete the case report of the patient in A opposite. Look at A, B, and C opposite to help you. Case 45. On examination, he looked unwell. His pulse rate was 100 per minute. He had a palpable spleen. The combination of fever and rigors in a patient who has recently returned from Africa strongly suggests a diagnosis of malaria. The incubation period is usually 10 to 14 days. In this case, the patient admitted he had not been taking prophylaxis regularly. The diagnosis was confirmed by the presence of parasites in his blood film. 34.3. Complete the sentences, look at A, B, and C opposite to help you. An infection which can be treated successfully with antibiotics is curable. 2. Another word for an epidemic is an outbreak. 3. Bacteria and viruses are examples of microorganisms. 4. Someone whose temperature is normal is febrile. 5. The common infection with Epstein-Barr virus is known as glandular fever. 25.1. Complete the table with words A, C, D, and E opposite. Noun, adjective. Affect, affective. Anxiety, anxious. Behavior, behavioral. Dementia, demented. Disturber, disturbed. Suicide, suicidal. 25.2. Make word combinations using a word from each box. 2 words can be used twice. Look at B, C, and E opposite to help you. So I'm gonna be reading the combinations words, okay? Behavioral syndrome, eating disorder, major depression, mental retardation, personality disorder, psychomotor retardation, sleep disturbance, substance abuse. 25.3. Complete the sentence. Look at A, C, D, and E opposite to help you. 1. The way a person behaves is his or her behavior. A persistent emotional state is a mood. 3. A sudden attack of anxiety is a panic attack. 4. The form of dementia associated with aging is called senile dementia. 5. A disorder which is not associated with pathological changes is dementia. 6. An idea which forces the patient to repeat unnecessarily actions is a compulsion. 25.4. Which symptoms of depression was this patient suffering from. Look at C opposite to help you. Case 41. A 16-year-old woman presented to her GP complaining of increasing tiredness over the past few months. She had lost interest in most things. She was sleeping poorly and tended to wake up early, but denying any suicidal tendencies. She was thirsty and was passing urine more often. She was eating normally and her weight was stable. The patient has tiredness, loss of interest, and insomnia. 26.1. Complete the table with words from A, B, and C opposite. Adjective. Noun. Blind, blindness. Conscious, consciousness. Deaf, deafness. Dizzy, dizziness. Numb, numbness. Lightheaded, lightheadedness. Unsteady, unsteadiness. 26.2. Make recommendations using a word from each box. Look at A, B, and C opposite to help you. Double vision, epileptic fit, prodromal symptom, syncopal attack, urinary incontinence, visual acuity. 26.3. A doctor is trying to determine the cause of loss of consciousness in a 52-year-old man. Complete the doctor's questions. Look at C opposite in the table in 26.1 above to help you. Did you lose consciousness suddenly or gradually? Did you get a syncopal of the attack? What were you doing before you passed out? Were you worried or under any stress at the time? Do you feel dizziness or lightheaded before the attack? Did you lose control in your bladders? Did your wife notice any involuntary movements while you were unconscious? 27.1. Complete the table with words from A and B opposite. Noun, adjective. Absence, absent. Diminution, diminutive. Flaccidity, flaccid. Spatic, spatic. Wastage, wasted. 27.2. A doctor is giving instructions to a patient during examination of the motor system. Identified by the doctor is assistant in each case. Look at A opposite to help you. 1. I'd like you to relax. I'm just going to move your arm up and down. Muscle buck. 2. Can I see your hands? Muscle tone. 3. Now I'm going to straight your arm out. Try to stop me. Muscle power. 4. Can you touch my finger with yours and then touch your nose? Good. Now do it again with your eyes closed. Coordinations. 27.3. Complete the sentences. Look at A, B, and C opposite and at the table in 27.1 above to help you. 1. A flaccid hand drops limply to form a right angle with the wrist. 2. Reflexes are reflexes that are stronger than normal. 3. Muscle wasting means the muscle is reduced in bulk. 4. A tic is a form of involuntary movement. 5. A key is often used to test the vacuum response. 6. His coordination was poor. He cannot perform rapid alternating movements. 7. A reflex hammer is used to test reflexes. 8. When something is involuntary, it is less than normal. 27.4. A patient is brought to an E in coma. When her name is spoken, she opens her eye, but she does not answer questions or obey instructions. What is her CCS score? He CCS eye open 2, speech 3, verbal response none 1, it responds not 1. 28.1. Complete the table with words from A, B, and C opposite and related forms. Verb, nouns, and adjectives. Cure, curative. Excise, excision. Growth, growing. Invasive, invasive. Abstraction, obstructive. Palliate, palliation, palliative. Palpate, palpability, palpable, spread, spreading, swell, swelling, swollen. 28.2. The notes below are about the patients described in B. Opposite. Use them to put the sentence 1 to 9 in the correct order to make the next paragraph of the case report. Use Appendix 2 on page 20 if you need help with the observations. OET 37.8 Celsius. Smooth, firm, 4 centimeters mass in our supraclavicular fossa. Nodes 1 to 2 centimeters in diameter, palpable in both axial and inguinal areas. Oropraxis NAD, P 100 per minute regular, BP 112 per 66. CBS NAD or SNAD, ABD mass palpable 3 centimeters below all costal margin, CNSNAD. 1. Examination of the central nervous system was normal, number 6. His mouth and throat were normal, number 3. They were smooth, firm, 3.4 centimeters mass in the right supraclavicular fossa. 7. His cardiovascular and respiration system were normal. 2. An abdominal examination, there was a mass palpable 3 centimeters below the left costal margin. Number 8. An examination, his temperature was 37.8 centimeters. Number 4. There were enlarged lymph nodes in both axial and linguinal areas. Number 5. His pulse rate was 100 per minute regular, and blood pressure 112 per 66. That's number 1. Now I'm gonna say it in order because I forgot. Sorry. So his pulse rate was 100 per minute regular, and blood pressure 112 per 66. That's number 1. His cardiovascular and respiratory system were normal. Number 2. His mouth and throat were normal. Number 3. An examination, his temperature was 37.8 Celsius. Number 4. There were enlarged lymph nodes in both axial and inguinal areas. Number 5. Examination of the central nervous system was normal. Number 6. There was a smooth, firm, 3.4 centimeters mass in the right supraclavicular fossa. Number 7. And number 8, an abdominal examination, there was a mass palpable 3 centimeters below the left costal margin. That's number 8. Now 28.3, complete the sentences. Look at A, B, and C opposite to help you. So distant parts of tumor cells in nose as metastasis. Many symptoms of cancer, such as difficulty swallowing, are due to space occupying lesion. 3. The opposite of painful is painless. 4. A malignant neoplasm is called a cancer. 5. Tumors which do not invade or metastasize are neoplasms. 6. Secondary tumors are those which result from the spread of a primary. 7. If a cure is not possible, palliative treatment should be given. 8. A palpable liver suggests metastasis. 28.1. Complete the sentences. Look at A, B, and C opposite to help you. 1. A baby that is born a week before the EDD is premature. 2. A termination of pregnancy might be necessary for medical reasons. 3. The first 3 months of pregnancy are known as the first trimester. 4. Fetal distress in the first stage of labor is an indication of cesarean section. 5. It was a breech presentation and delivery was by forces. 6. A miscarriage is another term for spontaneous abortion. 7. The umbilical cord was wound tightly around the baby's neck and it was unfortunately stillborn. 29. 29.2. Complete the table with words from A opposite. So we got verb and noun: abort, abort, deliver, delivery, induce, induction, miscarriage, miscarry, miscarriage, present, present, terminate, termination. 29.3. Dr. Burnett, as SHO, is presenting a patient at a weekly meeting in the obstetric unit of an hospital. Complete the presentation with the correct forms of verbs from 29.2 above. This is Clara Davis. She came to the antenatal clinic at 9 weeks. In her past obstetrics history, she had a pregnancy when she was 18, which was terminated, and another one a year later, which was spontaneously delivered. Since then, she had 3 pregnancies. In the first, the baby was delivered normally at 40 weeks. In the second, she had an induction of labor at 39 weeks because of fetal distress. The third baby presented as a breech and was delivered by a cesarean section. 30.1. Make word combinations using a word from each box. Look at A and B opposite to help you. Blunt stain, breath sounds, pleural rub, productive cough, vocal resonance. 30.2. Rewrite the questions using words that are better known to patients. Look at A opposite to help you. 1. It is your cough productive? What causes your cough? 2. What color is the sputum? What color is the phlegm? 3. It is ever purulent? It is even presents a flu. 4. Have you ever had hemoptysis? Have you ever had bloodstones? 5. Do you suffer from dysphonia? Do you present it to the dysphonia? 30.3. Are the following statements true or false? Give reasons for your answers using your medical knowledge, and A and B opposite to help you. A patient who has loose cough produces phlegm. True. Crackers are here when the airways are narrowed. False. A patient who has non-productive cough produces spun. False. Sneezes are typical of pleurism. False. A pleural rub is a sign of asthma. False. 31.1. Complete the description of herpes zoster singles by replacing the medical words in brackets with ordinary English words. Look at A and B opposite to help you. Single usually starts with pain and soreness, then a red spot appears that develop into groups of small blisters over a particular area on one side of the body. In most patients, new rash continued to appear for 3 to 5 days. The small blisters became filled with pus and then form a scab. In several cases, there might be scars afterwards. 31.2. Read the description of the rash of rubella and complete the notes. Look at A and B opposite to help you. The spots are scattered pink muscles, which appear first behind the ears and on the forehead. The rash spread rapidly first to the trunk and then the limbs. Location and distribution: first behind the ears and on the forehead, then the trunk and limbs. Grouping: scatter, type of lesion, mucus, color pink. 31.3. Complete the notes of the rash in the photograph and suggest a diagnosis. Look at A and B opposite to help you. Location and distribution: distress on the chest and abdomen. Grouping: setted, type of lesion, small muscles with some scales, color pink. 31.4. Complete the notes for the lesion in the photograph and suggest a diagnosis. Look at A and B opposite to help you. Location and distribution below lateral angle of the eye. Grouping: single, type of lesion, nodal, color white, pink. 32.1. Write the corresponding medical terms for the ordinary English words and say what kind of force is involved. Look at A opposite to help you. So we got common word, medical term, type of force. Bruise, contusion, blood. Cut, Inside wound chart. Grace, abrasion, blunt. Scratch, abrasion, blunt. Stab wound, penetrating wound, shaped. Tear, laceration, blunt. 32.2 shows the correct words to complete the description of the injuries shown in the illustration. Look at A and B opposite to help you. There are grazes above the left eyebrow, and on the left side of the neck a contusion to the left side of the lower lip, and tears to the left cheek. 32.3 write a description of the injuries shown in the illustration. Look at A and B opposite and add 32.2 above to help you. There is a laceration on the left shoulder and an incisive wound in above the left nipple. 32.4 complete the sentences. Look at A, B, and C opposite to help you. Frequent changes of position are necessarily in the immovable patient to prevent the development of pressure sore. He had several stab wounds in the abdomen from the knife. He has knocked concussions by a heavy blow on the head. The wounds were only superficial and required no treatment. 3.1 look at the conversation in A opposite and complete the notes about Mr. Jones. Use medical terms where possible. CO frequently and nocturia for 1 year. Now dysuria or hesitancy. Strain a little weaker. Not incontinence apart from occasional driveling. 32.2 match the patient's descriptions of their symptoms 1 to 7 with the medical terms A to G. Look at A opposite to help you. 1. I have to pee every half hour or so. Frequency. I get a scattering pain where I pass water. Dysuria. I have to get up several times to pass water at night. Nocturia. I have to rush to go to the toilet. Urgency. I have trouble getting started. Hesitancy. I can hold my water. Incontinence. I pass some blood in my urine. Hematuria. 33.3 write the doctor's questions from each of the symptoms in 32.2 above. Look at A opposite to help you. You will need to think of your own questions for urgency. Frequency, how often do you urinate? Dysuria, do you have pain or burning when you urinate? Nocturia, did you have to get up at night? Urgency, did you feel an urge to urinate? Dysuria, do you urinate with blood? Hesitancy, do you have any trouble getting started? Incontinence, do you ever lose control of your bladder? 33.4 describe the findings of the laboratory report in words. Look at B opposite to help you. There was a trace of blood across perimeter and no cast. 4.1 a doctor is talking to a patient during an ophthalmoscopy. Match the underlying expression she uses 1 to 4, two expressions with similar meanings from A opposite A to D. So write Mr. Gold, because you have been keep having these headaches, I'm going to have a look at your eyes, particularly the back of your eye, the retina. I'm going to put a couple of drops in your eye, so that you might say a topical mydriatic solution. 2. Which will make it easier for me to see the retina. To aid dilatation. After a few minutes you might find your vision a bit blurry. This will wear off after about an hour. Now 3. I need to get rid of as much external light as possible. This means closing the blinds. 3 could be an examination is done with diamond lights. Now I'd like you to, number 4, look straight ahead at that clock. It would be Fixate on a target. This takes a few minutes and your eyes might feel a bit tired, so you can blink if you need to. I don't want you to look at me, look at the clock. 34.2. Complete the instructions. Look at B opposite to help you. 1. Grab the cut around the patient's upper arm. 2. Place the diaphragm over the area of the brachial artery. Raise the patient's arm so that the brachial artery is at the same height as the heart. 3. Close the bowel of the pump. 4. Pump up the pressure to at least 150 mmHg. Open the bowel a little and slow deflate the cuff while listening and watching the pressure gauge. 5. The first sound you hear is the flow of blood through the brachial artery. The bowel on the gauge at that point is the systolic blood pressure. 6. Continue listening while you slowly deflate the cuff. 7. The diastolic blood pressure is measured when the sound completely disappears. 34.3. Complete the text. Look at C opposite to help you. A phlebotomy are specialized trained in taking blood. They are skilled at picturing the vein to take a blood sample. The wrist, hand, and foot can be used, but more often a vein in the inner part of the elbow is used. It is difficult to locate a suitable vein. The patient might be asked to make a fist, or a tourniquet may be applied on the upper arm to make the vein more apparent. Afterwards, a dressing is applied and the patient is asked to press gently. This helps to stop the bleeding and prevent bruising at the site. It is important that specimen tubes are labeled correctly before they are sent to the hematology laboratory, where a full blood count or other investigation will be carried out. Thank you.